In the Vita Spotlight this morning, Dr. Mark Iannettone. How'd I do?
Very good.
Is that it? Iannettone?
That's it.
All right, very good. Dr. Iannettone is the chair of the Department of Cardiovascular Services and the chief of cardiovascular services at the East Carolina Heart Institute and Vidant Medical Center here in Greenville. It's Heart Month. We've been talking about that. February is Heart Month, and you've got some good information to share. How you doing this morning?
I'm doing great. Thanks for inviting us to be here.
Yeah.
We're pretty blessed in this region to have one of the best cardiac programs in the country based on our outcomes and some of the technology that we have here. I'd like to spend a little time today talking about some of the services and opportunities that we've been providing for the region. East Carolina Heart Institute at Vidant Medical Center is one of the busiest myocardial infarction or heart attack centers in the country, performing over 1,000 procedures a year to open clogged arteries. We perform the largest number of cardiac operations in the state, and we're nationally ranked for our outcomes. ECHI serves about 29 counties throughout eastern North Carolina, and with our collaboration with Vidant and the Brody School of Medicine, we provide some of the most technologically advanced procedures. Specifically, since this is Women's Heart Month, it used to be that when we would have to look at the coronary arteries or try to do what we call a diagnostic cath, what would happen is we'd have to make a puncture or an incision in the groin, and that sort of endangered the leg and it caused some problems. And in women, especially with much smaller arteries, it makes it a little bit difficult to do that sometimes. We've developed a procedure where this can be done through the artery in the wrist, and people can have all of their intervention as well as their diagnostic procedures through their wrist instead of having to have this puncture in their leg, lie flat for a while, have complications with that.
Interesting. You know, my daughter is a cardiac cath nurse in Charleston, and that's what she does. So it's interesting to hear that. Is it specifically women that you're doing the catheterization through the wrist now rather than through the groin?
It's almost everybody who qualifies, and almost everybody qualifies, but I will say that it's probably women who like that the best.
Yeah, yeah. So, you know, we hear about heart disease being such a big deal for men, but is it also the #1 killer of women?
It actually is. The problem is that there's lots of studies out there that have shown that we don't treat women the same who have heart disease, in the sense that it's either recognized with a different set of symptoms, it's recognized in a different format. They don't present the same way that men do with the typical chest pain down the arm. And they often seek treatment late because nobody else is going to be around to take care of the kids or make sure everything else is done. And so they tend to forego some of their medical care, but they have just as severe and sometimes worse outcomes.
Wow. Dr. Mark Iannettone, the chair of cardiovascular sciences at the East Carolina Heart Institute. We're so fortunate to have this facility in eastern North Carolina. It's really changed. You talk about the outcomes, meaning, you know, there's no good place to have a heart attack, but if you're going to have one in eastern North Carolina, we can take care of you, right?
This is one of the best places. Having been other places like Michigan and University of Iowa, this is a top-notch facility. The facilities are almost brand new and continue to evolve. We've got great people, and it's just a wonderful place to be.
Yeah. What else are you focused on this month?
So the other thing that we've been focusing on is because of our somewhat rural population and our own areas of economic issues that we have here, we have a large number of patients who have heart failure, and this is becoming a growing problem throughout the region, throughout the country, and heart failure has been very difficult to take care of. We've just started a very aggressive and progressive heart failure program here that allows for patients to be treated not only medically, but with some new devices that we can implant that can monitor their heart function as it declines, and just by basically the same information we can get over the phone. We can make changes to their medications and their care. It's called the CardioMIM system, and it's an implanted device that we can now monitor people outside of the hospital and prevent them from having to come back.
Wow. It's amazing how things have changed, isn't it?
Yeah, it used to be that everybody had to have a big open operation. Now we have procedures that don't even require an open procedure called a transaortic valve replacement. We can replace people's valves without opening their chest or by making very small incisions, reconstruct their valves. People spend 2 to 3 days in the hospital and sometimes just overnight after having a valve replacement, which used to be a 10-day hospital stay with all sorts of problems.
Mm-hmm. Well, it's something to think about. The heart. They say we live in the stroke and heart attack belt.
We do. We have a disproportionate mortality with our heart disease here.
Why is that?
Well, I think a lot of it has to do with
lifestyle,
people not seeking care, and quite frankly, we serve a 29-county region along with Vidant Medical Center, and getting people in and getting them access to health care immediately is sometimes very difficult. So fortunately, we have some other new programs with newer technologies that allow us to support people's hearts for a short period of time until we can recover them. But getting people to get to their doctor, to get the primary care that they need, and change their lifestyle is a huge problem.
Well, we preach this all the time. We have a world-class medical community here in Greenville, and we've been able to attract great doctors like you. And so, we're very appreciative of all that happens at Vidant Health and the ECU School of Medicine, and now, particularly for folks that need heart services, the East Carolina Heart Institute. It's been a game changer for Eastern North Carolina, hasn't it?
Yeah, it's been a great opportunity to come here. Vidant has made some huge investments in quality of care, and ECU has done a great job of attracting new and great people here to work with. So thank you very much.
Doc, thanks for being here.
Okay, thank you.
Nice to meet you. Dr. Mark Iannettone, the Department Chair of Cardiovascular Sciences and Chief of Cardiovascular Service at the Eastern Carolina Heart Institute and Vidant Medical Center here in Greenville.